because of the very small, albeit there is a commonality, there is a risk association with the two. So if any, as Dr. B said, if any other cancer that has any association with the myeloma, that would be another blood cancer. And I think the rationale behind that would be uh, genetic mutations happening at the place of the bone marrow level, and not something that's coming from generations on, but just happening right now here, and that would affect the all the cells of the marrow to some extent. So that's possible. One of the reasons is possible. Another reason could be the exposure to the old-fashioned chemotherapy that we used to give could give rise to some of this leukemia lymphoma down the road, but that's not a thing to worry about now because we don't use that chemotherapy most of the time, except for maybe sometimes with the transplant, preparatory regimens and all of those things. Okay, so what is lymphoma? What is a leukemia? So as Dr. B mentioned about multiple myeloma being a cancer of the plasma cells, because those cells make the plasma in our blood, the liquid part, which has all the good antibodies that protect us from infections. So the second, this is a liquid part of the blood, plasma. So there is a solid part of the immunity, and I call it, think of it as your country's defense mechanism. So you have the army, you have the navy, and then you have the air force, and then you have CIA. Okay. So I call the white blood cells, call it army if you want to, then and then there are the T cells and B cells, the lymphocytes in our type of white blood cells that could be a different format of that same immunity. The liquid immunity, we just talked about the plasma cells, in the form of it. So this is quite a complicated thing, but basically, leukemia means cancer of the white blood cell, and that, of course, it's a scary word, and I think, I mean, as we all probably know, it is a dangerous condition. It needs to be treated very quickly. The four types of leukemia. The fourth type does not even belong to. I mean, it belongs to the family of leukemias, but really, I sometimes even think that it should be thrown out of the family because CLL, you must have heard of that sometimes here and there, the chronic lymphocytic leukemia, is doesn't need to be treated sometimes. Sometimes it has to be. So it varies quite a bit, but it's not as dangerous as the other three siblings of it. Are the AML, the ALL is fatal within weeks. AML, so those are leukemias, the cancer of the white blood cells. And a part of the white blood cells are lymphocytes. Lymphocytes form the lymph. When they are together, they make our lymph gland, the spleen. We have a huge army. I mean, it's such a complicated system. It's amazing. And you just look up and say, wow, who made this, So it is something. So the cancer of those lymph glands or lymph cells is lymphoma. And if it is floating in the blood, it could be called leukemia because they are after all the white blood cell family overall. But lymphoma essentially is a cancer of the lymph glands. Hodgkin's, non-Hodgkin's, two words you might have heard. And then there are tons of subclassification. I think there are at least, give and take 25, 30 different subtypes of lymphoma, and four subtypes of leukemia that, we don't have to, we don't learn that all that right now. But it can, but these are dangerous conditions. It is, I think, in my opinion, in fact, well, I cannot say that it is more dangerous than myeloma or not, because some myeloma set is extremely fast going type, and others are very slow. Um, Lymphomas, they vary a lot. Leukemia is inherently quite a bit fatal condition.